So good afternoon, everyone. On behalf of Patients Engage, Club2Care and SINDA, we are very happy to talk about a difficult topic at this point. Let me quickly do a quick introduction of the organizations involved. And so just for those who don't know, Patients Engage is an online platform dealing with chronic conditions. We are focused on holistic and evidence-based management of chronic conditions and focus on lived experiences and perspectives of patients and family caregivers. We cover over 50 conditions and mental health is one of them. What we find is that the lived experiences help people be better informed and empowered, and this leads to better quality of life as well as better health outcomes. We've been doing a series of webinars, and especially during the COVID time in the last 2 months, we've done, I think, more than 20 webinars on a range of topics. And we've spoken with experts as well as with people with lived experiences. One of the things we've noticed in the last month or so is that there's been an increase in a feeling of anxiety and a feeling of depression, isolation, loss of privacy, various issues. And so we've tried to address that with a series of webinars relating to mental health. So we had done one with Club2Care at the end of March, which was for women living with depression. And subsequently, we've done a couple on mental health and well-being, as well as guidance for mental illness and their caregivers, for persons with mental illness and their caregivers. We also did on how people can build emotional resilience, especially those living with disabilities. Today's topic is again linked to the fact that we are seeing a lot of people talk about tightness in chest, anxiety, lack of sleep, etc. So we thought it was an opportune time, and we partnering with Club2Care and with SINDA on this topic. Our panelists today are Dr. Nigila Ravichandran from IMH and art therapist and counselor Shradha Mestri. Just a quick guidance to attendees. This does not replace personal consultation, so please do still consult your doctor or your therapist. So quick introduction again, as I already said, Dr. Nigila Ravichandran is a consultant psychiatrist at the Institute of Mental Health in Singapore. And Shradha Sudhir Mestri is a counselor and art therapist. And I'm Aparna, I'm the moderator for this session. So Dr. Nigila, would you like to quickly introduce Club2Care?
Yeah, thank you, Aparna. I'm Dr. Nigila Ravichandran. I'm a volunteer and vice president with Club2Care. I look after the well-being arm of the Club2Care voluntary organization. So our organization's goals are to raise awareness about mental wellness and provide care to those in need. So at present, what we do is counseling, interactive talks, we do webinars and community training. And we have our website, which is www.club2care.com. We are also on Facebook at this link, and we have an email, club2care@gmail.com, and there are 24-hour emergency helplines. If you go to the website, there is also a new contact number which operates on certain days, which will be manned by our staff on certain days to make your inquiries and also to find out how to be referred to Club2Care. So basically what we do is to create awareness among the members of the community about mental health, mental wellness, and also to provide help.
Sorry.
Yeah. So these are the other helplines, as you can call. You can see there are several organizations, several help resources in Singapore. So the topmost will be those of the Samaritans of Singapore. Then we have the Singapore Association for Mental Health. Then we have the Clarity Counseling Center, Mind Care Counseling Center, which is at Amokyo. Then we have the Care Corner Counseling Center and Club Heal, which is quite similar to Club2Care, but there are some different objectives to Club Heal also. So again, the focus is on mental health and mental wellness. And there are other community resources which come under IMH, which is the chat, which is meant for young people. Then we have the early psychosis intervention program, which is an inpatient and outpatient program, which runs at IMH. Then there are the community wellness clinics at both Geylang and Queenstown. And there is a general hotline in IMH, and there is mobile crisis team at IMH, which operates 24 hours. The contact line is open 24 hours. So this is about the community resources which can be reached out for people who are in need of mental health resources.
Thank you, Dr. Nigila. Just to remind people, since we have an art therapist on the panel, it will help if you bring a paper and a pen as well. There will be a small exercise to get you started if you would like to join. There's no compulsion, but it's just an introduction. And keep your questions coming. While we will be asking some of the questions we've already received, we will be taking questions from the live feed as well. So, again, one of the things we've seen on both, I think Club2Care has seen this and Patients Engage has seen it, and I think today's Straits Times also talked about it, is that there is impact on mental health for the various segments that we have, right? So the youth are anxious about what the future holds for them. The elderly are anxious because, they are being told time and time again that they are at greater risk. And there is the increased pressure of trying to be productive from home, which is often not possible in the closed confines of a home. Plus you lose your whole structure and routine, right? So the reaction to this varies from people to people. Today our focus is on anxiety, so we won't address all possible mental health reactions to this. But Dr. Nigila, worrying and anxiety is also a natural response, right, for survival of humankind. It's kind of a coping mechanism as well. So how can one differentiate anxiety as a natural response from the symptoms of it becoming a mental health issue or a disorder?
Yeah, this is a great question. I think this is a question that is in the minds of many people. And I've been asked this question many times also. So, when you talk about anxiety, when you talk about worry, I think it is a very, very natural human response. And it does not really happen only in people of certain age groups, because it can happen in people very young, people of the adult age group, people who are old. So, there is no particular age or category of people who feel anxious or worried, which is normal, which is actually in some ways it is also something that drives us to do our daily tasks. But when you are talking about anxiety as a problem, then it starts getting in the way of your daily life. It starts getting in the way of your routine. Then it becomes a problem. And when we start calling it a disorder, anxiety disorder, it has affected your life in at least more than one or two ways, in some ways or the other. So the common things which get affected because of anxiety will be like your ability to complete tasks, your ability to sleep. Sometimes people start even like skipping meals or becoming disinterested in meals, etc. Quite similar to depression, but it is not quite depression yet. Then it starts getting in the way. It leads you to not work or be productive at your workplace. It makes you snappy. It makes you irritable. It actually starts affecting your relationship with people, both at home as well as outside. So when it starts becoming, it starts disrupting the order in your life or the routine in your life. That's when we start calling it anxiety disorder. So having a certain extent of anxiety is actually healthy. It's actually quite productive. But when it becomes too much, that's when it becomes a disorder.
Right. And what are the different approaches to dealing with anxiety when it becomes a disorder?
So when a person presents with anxiety, so there are different types of people who may come across people who have anxiety. So it can be counselors, it can be psychologists, it can be people who are in the helping process. Anybody in the community could be dealing with anxiety. So I think one of the things which happens in people with anxiety is that they are reassurance seeking. They keep asking the same question again and again. They want to know answers. They sometimes can be repetitive, and they want to know whether what they are feeling is something normal or not normal. So there'll be a lot of reassurance seeking. So when they come to people like us, to the psychiatrist, what we do is there is a structured way of uh, doing the assessment. So we go through the history, we do a proper clinical assessment. Again, in psychiatry, our assessments are by talking. So we talk to the person, we find out what is making them anxious. Well, most of the time, we are able to identify the reason or the trigger for the anxiety, but sometimes we do not know the reason for the anxiety. Then we find out how this is affecting the person's life, in what ways the person's usual or normal life or the pre-morbid life, as we call it, has been changed for them. And then once we are sure that this person is suffering from anxiety disorder, so in a clinical perspective, what we do is we usually have different ways of approaching. So one will be the pharmacological way, the use of medications. The other way will be the psychological methods. And in psychological methods, there are many ways of dealing with anxiety. So there can be what is known as the talk therapies. There can be the coping mechanisms. There can be relaxation techniques. There can be the more advanced or more in-depth therapy sessions like cognitive behavior therapy and the other forms of talking therapy which can be used. And we also have several other methods, like one of them I think later Shradha will be talking about. It's like there are ways like art, music, and other forms of engagement which can actually bring down anxiety. So, but if you ask from a clinical perspective, the approach will be at least two-pronged. We use both medications as well as psychological help for anxiety.
Right.
Yeah.
Thank you, Dr. Nigila. Let me bring in Shradha at this point. Shradha, as a counselor and an art therapist, what is the role of art as a therapeutic tool?
Okay. Hello, everyone. Good afternoon. First, let me differentiate between what is art therapy, and art. Under arts therapy, like we have very different forms. We have drama therapy, we have singing therapy, we have dancing therapy. So these are different form of arts, ARTS, arts therapy. Under art therapy, we use simple design pattern which are given to the client who is suffering from anxiety, and we help this, like we use this simple design pattern to make the client calm down, to focus on his breathing, to focus on his sensory motor movement. These are the uses of art therapy. And what is art? Like artist, which we normally see a very big canvas with big paintings and using colors, that is completely different part from art therapy. How art therapy is used? It is used to get in touch with your own emotions, get in touch with your own thoughts. It also fosters your self-esteem. It makes you aware about your own intensity, own thought process. Then it promotes insight to you that what are you going through, and how it can be used in your counseling session or art therapy session. We, like many a times we see that clients are unable to talk or unable to communicate what are they going through. They are unable to communicate their emotions or their thoughts effectively. At this moment, we use art as a tool, so through which they can communicate what are their thoughts and what are their emotions. So art can be used as a tool to build a bridge between a client and a counselor or an art therapist. So it is a complementary therapy along with psychological therapies and clinical medication.
Right. So, I can see a nice piece of art behind you, Shraddha, right? But I am not an artist. So, how do I start and where do I begin if I have to use art as therapy?
Yeah. First thing, thanks. Second thing, for doing this type of art, it's like we have to start from a small paper and pen. This is nothing big. It just looks like, it just appears big. But to start, we can just use our pen and paper, simple pen and paper. For this, you don't have to be a very good artist, or you don't have to know like which colors you have to use or which designs. Normally, I feel that each and every human being who is born, he is a born artist. Only there are few who take it as a hobby, like take it as a career. So few designs we are like, we all human beings are born as an artist. So these are the few designs I would like to, like if people are ready with their pen and pencil and paper, they can start with this. Just draw few designs. Now what you are going to do is,
Can you
this
lift
design,
it up higher slightly? Yeah, thanks.
this,
Yeah.
okay, these designs. Now what we are going to do, whenever we feel lonely or whenever we feel that, okay, we have lost our confidence and we are lonely and we are lost interest, what we can do is like through art therapy, what we can do is just take paper, pen, just draw a square. And you don't have to fill this whole paper with art, not necessary. Otherwise, that will also make you anxious. Oh my God, I have to fill this whole paper and I don't know, I'm just a zero in art. So this is small square which you can draw, and just fill this small square with circles. Some small circles, some big circles. Just fill this with circles. And then fill this gap. This is how your art therapy starts. This is your first session,
Right.
like for art therapy. Just fill these gaps and you will see that within like for 5 to 10 minutes, you have made a very beautiful art piece in this way. Now how does this affect? Whenever you're focusing on this particular part, you have to fill this square with circles. Whenever you're focusing on this, you are totally like unaware about your worries or thought process which hinder in your life. Okay, you're focusing on this part only. Whenever you're focusing on this part, your hand, you get good control on your hand. Good control on your hand will surely ensure good control on your mind, good control on your breathing process, which will help you to make your mind calm. And a calm mind can think productively, can assess productively. You will be able to get closer to your emotions, get clarity of your emotions, get clarity of your thought process. And if you're unable to communicate with any counselor or a psychiatric what you're going through, this will help you to communicate more effectively. So art, for like anyone who is zero in art, who doesn't know anything about art, they can just start. And normally we do this whenever like we are traveling through flight and we are boredom, we just use our pen and we just keep on scribbling. Okay, something, we'll draw a flower or we will draw some lines. So that's what art therapy goes. This is how the session continues.
Okay. Thank you. So just to clarify, there are 2 or 3 things that seem to work, right? One is that there is repetitive movement that you're trying to get somebody to do, as well as you're trying to do small designs such that they are focused on kind of filling that space, and it takes their mind away from what is going on in that mind, because an anxious person, essentially that mind is working at top speed, right? Essentially, so you're trying to redirect that thought process.
What Dr. Nigila has said, that what leads to anxiety? First thing is our irrational thought process. There is something which we keep on thinking out of our control, but then too we keep on thinking about that part, and that makes us very anxious because we are not able to change. Now what we do in art therapy, we just divert that thought process to art. We try to tell you to focus on your art. Now what does this mean? Like how this helps? When we are focusing on our art, we are away from those thoughts which leads to anxiety.
Right.
And that is how art therapy work with other medications and other therapy.
Okay.
So it's like, I can say it's a part of, we can use it as a cognitive behavior therapy. What is cognitive behavior therapy? We try to focus on thought process, we try to focus on cognitions we try to focus on stressors which lead to anxiety. So we
Right.
can use art therapy as a complementary with cognitive behavior therapy or exposure therapy or talk therapy, any kind of therapy.
So I'm going to take one of the questions that's come in now because I think it's kind of linked. Must the art always be abstract? Can we use portrait drawing or painting to calm down our nerves? Can I
Yeah.
use a pre-drawn drawing to color only?
Yes, yes. See, these are some types of like few books which are available in market where we can get these portraits or these scenery designs. I think so. It's clear. Yeah.
Yeah.
Scenery designs or say portraits. Now here we don't have to draw. We just have to copy. We just have to use pencil and pencil for shading.
Mm.
Again, what we are doing here, the same thing. We are diverting our attention from those thoughts which leads to anxiety to those thoughts which leads to make our mind calm.
Right.
So any type of drawing, abstract drawing or portrait drawing or scenery drawing, which makes you happy and which makes you relax, that is art therapy.
Right.
So
Thanks.
you can
Thanks,
use
Shradha.
any art medium.
Right. Thank you. Dr. Nigila, one of the common concerns we are seeing, as I said, we get a lot of comments and questions. I think the biggest impact seems to be people's sleep is affected. So they are, struggling to sleep. They talk of feeling continuously anxious, tightness in chest, can't stop thinking about the current situation. The news feeds that come in are all about COVID. So, what should the person do in such a scenario?
Again, thanks, Aparna. This is another common question. I think this is it weighs down on the minds of most of us. And unfortunately, what happens is whenever somebody is stressed by anything, it can be from like the current situation, like we have the pandemic. It can be any worry we have about, like say, our daily work, our something to do with the family, or somebody is sick, or even like good events, like weddings, going to have a child, or one of your children is going to leave home and maybe go out to work or study or something like that. All these can be very stressful, and all these can provoke anxiety. All these can provoke some of the symptoms of anxiety. Does not have to be to the extent of leading you to have a disorder, but this can affect your anxiety. This can affect your well-being in some way or the other. And what happens is the first thing that gets affected, or the commonly noticed thing that gets affected, is the sleep. This happens in anxiety, this happens in any form of stress, this happens in depression or many mental health. One of the things that gets affected is your sleep. So what happens is when you are feeling anxious, when you're worried, you tend to keep thinking. Your mind is playing again and again. It's something like a replay of something that's going on, and this definitely leads to you getting your sleep affected. So commonly, what we see in a person with anxiety is that they are not able to initiate sleep. So we have like these two problems with sleep. One can be the sleep cannot be initiated. Say you have a bedtime practice of going to bed at 10 p.m. You go and lie down on bed. Most people say I can just knock the pillow and I can sleep, but you may not be able to do that. The initiation gets affected. Then the second thing that gets affected is that the interrupted sleep, or that a sleep which is not restful or not deep enough for you to feel well the next day. So this is the interrupted sleep. So in anxiety, what happens is usually it's the initiation that gets affected. So what we usually generally advise people when they come with a sleep problem is like, again, we find out what is happening in their life in the background, and then we usually recommend what is known as a sleep hygiene. So when we say sleep hygiene, it is like having a physical hygiene, a bodily hygiene. This is very important. I think all of us can practice it. One thing is like we must have a regular time of sleep. It does not have to be strictly 10 p.m. It can be something around that time. Say if you want to go to bed at 10 p.m. or 11 p.m., fix the time around there. And before that, before you go to bed, kind of prepare your environment for sleep. So it means it starts from your living room. So you make sure that you're not going to be watching any very exciting programs, or maybe like sad programs, fear provoking programs, or those which could be causing you a fear. Like some people like to watch late night shows which are like ghost stories and fights and etc. So try not to watch those before you go to bed, especially those who have problems with sleep, especially those who are prone for anxiety. And then the other thing is like phone off, or at least put it on mute, because I think the tendency nowadays is to keep looking at your phone, looking at your WhatsApp messages, your Facebook messages, and all other social media platform you have. You want to make sure that you are keeping update with everything. Yeah, that's fine, but now is your bedtime, now is your sleep time. Turn those off. What I do is I turn my phone off just before I go to bed. My phone is switched off, completely switched off, unless I'm on call or something. So turn your phone off, because that time is yours. Your body needs that rest. And the third thing is like make your bedroom as conducive to sleep as possible. Some of us like the room to be completely dark. Some of us like to have like maybe like a soft light or night light. It's okay. Some of us like music, a soft, gentle music playing in the background. If you like all that, have that in the background. Then if you like, some people like to have like a warm shower before going to bed. Do that and prepare for the next day. Because if you are going to, like, say you have to start the next day early, prepare for the day. Like, start planning from the evening, and say you have to keep your things in order, like prepare your files, prepare your bag and other things, put your laptop in its place, put the bag ready, keep everything ready so that before you go to bed, you know for sure that you're ready for the next day's meeting. Or if say you are going to be cooking for your family, or you're expecting guests, prepare some of the things which you can keep ready for the next day, and then you go to bed. When you go to bed, you should have that peace of mind that yes, I'm ready for the next day. All of us go to bed with a hope that next day is going to be a better day. And go lie down. Once you lie down, switch off completely. Like you switch off your phone, you switch off all these thoughts and other things. And it's very easy when I say that, but you can't do that. So one thing is like, one of the things you can do is when you lie down, you just start thinking of what went well for you that day. You don't have to start thinking about what went bad for you that day. What went well for you that day? Were you able to bring a smile to somebody, or were you able to smile at somebody in maybe in the most relaxing or the calm manner? If you have been able to do that, then your day has ended well. So just close your eyes and you tell yourself, it's like something like kind of self motivation, self hypnosis. Just tell yourself, now is my sleep time. I'm going to sleep. Close your eyes. It does not happen so easily. It does not come to you very easily. But with practice, with persistence, being consistent, you can actually start feeling that you're going to sleep very easily within like maybe 1 to 2 weeks. And you will see that by the end of third week, you have been sleeping well, you have been resting well, and when you wake up in the morning, you feel that freshness. That is very important to feel, because even if you have slept the whole night and if it has been interrupted and you have felt edgy or fidgety, then when you wake up next day, you can feel very tired. You won't be ready for the day. So I think preparing for your day, for the next day, preparing for your sleep, and getting to bed is important. This is
Right.
the way you actually show respect to your body. The body has been working the whole day, and you're giving it the rest it needs, and for your brain to regenerate. This is very important. So this is actually kind of the steps you can take to have a proper sleep hygiene. So this can apply to any health condition, and especially for anxiety.
Right. Thank you,
Thank
Dr.
you.
Nigila. How does spirituality, or does spirituality help as a tool for coping with anxiety?
Um, I would say if people believe in spirituality, if people believe in something that is above them, believing in that, focusing on that, like we know we have many methods. Even in our Indian culture, we have this meditation, yoga, and other forms of spirituality. It is kind of I would say it helps you to focus better. It helps you to bring down your anxiety. directly it has effects on it. I'm not the expert to talk about it, but I would say it would, the way it would work is like it would help in focusing. There is an inner focus which helps you to feel calmer and more relaxed.
Right, right. Yeah, I think to that, I would like to add, based on again our experiences, that it doesn't necessarily work for everyone. So, so we often hear of family members telling somebody to take on spirituality and that will solve your problem. That doesn't necessarily work, right? It has to be something that the person feels that it might work for them rather than rely on somebody else telling them that. So I think that's a different distinction. Um, Shraddha, I guess you talked of art therapy. Does it help as an intervention or as a preventive measure?
Hello. Yeah, it helps in both ways. It helps as an intervention also, and it helps as a preventive measures also. Initially, when we started this session, Dr. Nigila told us that what is the difference of getting anxious and diagnosed as an anxiety disorder. Okay, so we know always that whenever we are having our exams or whenever we are having our say job interview or whenever we are having webinar, some people get anxious. So we can use art therapy as a preventive measure also. Again, I would like to say that if you are consistent, committed, and if you are doing it regularly, it will surely help you to get relief of anxiety before it turns into anxiety disorder.
Right.
So it acts as a preventive measure.
Okay.
Also, related to spirituality, I would like to add one point here. There is one type of art that is mandala art, and mandala art is related to spirituality. So not only while doing mandala art, but also after doing your mandala art, focusing on that mandala helps you to get relief of anxiety or stress that leads to anxiety.
Right. Okay. Thank you. Let's take a couple of questions that have come. One person says, I have a routine but yet cannot sleep. Doctor prescribed anxiety medicines for me, but I believe menopause also affects my sleep. Doctor, do you think so? Will long-term consumption of anxiety meds, are they good for the body or the mind?
I will answer this. Again, or whatever medications you are taking has to be in consultation with your primary doctor. So if you're taking medications for sleep or anxiety, it is best always to discuss with your doctor. And if see whether the medication helps you or not. If it is not helping you, then it's best again to go back to your doctor and discuss or have a consultation or say on phone or whatever mode is available. And menopause probably has some contribution in affecting a person's emotions, but whether it has a direct effect on sleep, I'm not sure about it. I don't think so. I would say that medications used for a period of time are pretty safe. To be taking them long term without any proper indication, without any proper consultation or discussion with your doctor is not a very safe option also. If it is needed for a period of time, yes, it can be taken. But long term, please discuss with your doctor, because there are many medications which are required for long term conditions, but anxiety may not fall in that category. It's best you discuss first.
So
And
just
never
to
take medication. No self medication, no self prescription of medication. Not at all.
Correct. I think that's important. No self-medication, but I think on menopause, I would like to add that there could be other physical symptoms that affect your sleep. So if you are getting hot flushes in the night, then you need to make sure that your room is calm, cool, and make sure that you're exercising, because I think what often happens is that when you're going through those hormonal changes, sometimes people reduce their level of exercise, and that then affects the sleep as well. And there is, anecdotally, it does seem that, kind of women tend to worry a bit more during that period, based on a few examples we've heard. So I think, again, try and work on the sleep hygiene, and try and do some more meditation or calming activities, or maybe try art therapy, as Shradha has been talking about. Um,
I would just
I
like to add there.
Sure.
Yeah, just one more point to add there. Any form of menstrual change, any form of hormonal change that happens in your body, like right from the start of your menstruation at menarche, during your menstrual cycles, and during menopause, and even after menopause, there can be effect on your emotions, there can be effect on your general well-being when there are these hormonal changes, because these changes are always going on, and there are periods when the changes are very heightened, meaning during those phases, like menopause. So there can be a play of emotions, there can be a play of physical symptoms. So if we understand that this is again a normal phase in life, this is actually a normal physiological phenomenon in our human body, then it won't be so anxiety.
Right. So somebody said, thank you for this session. Your discussions are directed towards the patient. How would you suggest that the patient avail themselves of these options? Often they are in denial. I guess this is also links to the question I was going to ask you, doctor, about, how should a family support, or family or friend support, or respond to someone going through anxiety?
Yeah, I think the question in the minds of the family is that how can I help my loved one who's going through the anxiety? So most often you may not be able to solve the problem for them, but what you can do is at least listen to them. You can spare some time sitting down, listening to them, or trying to understand what is happening in their life, because this is probably a definite change from what the person has been going through. There are people who are, I would say, chronically anxious. They are worried about everything. The warriors. They never stop worrying about anything. But there are people who can take things in life. They can take pressures in life, but then at some point of time, something new or something different seems to worry them a lot. So if there can be at least one member of the family or a friend who can sit and listen to them and understand what is happening, listen to them, find out what is happening, and then you can make suggestions to the person saying that, okay, maybe we should get more professional help. So if you're not willing to go to see a doctor, there are other resources you can go to. You can actually go to counseling centers. You can go to your primary doctor, your general practitioners. You can go to your polyclinic doctors. Actually describe what you're going through, and these people are able to help you to some extent. Actually, the counselors can actually listen to you from their professional angle and from professional viewpoint, and they may be able to give you suggestions. Not everybody who's going through anxiety or anxiety disorder needs to be on medications. Again, I said from a doctor's perspective, the thought or the clinical view is medications and pharmacological methods, but we don't always say that medications are the only way to help you. There are other ways to help you also. So I think one of the things most people want at the time is that kind of reassurance, that kind of feeling close to somebody, feeling being like listened to, being heard out. That is important. So if you can be the listening ear, that will be great. And you can make suggestions. Okay, you don't want to see the psychiatrist. I think that's still taboo in our society. So at least go to the nearest possible person, the person you trust, the person you can feel comfortable with. So very often, most of us have at least one family doctor or a general practitioner who is near home. Go to them, talk to them about it, and if this person suggests, okay, maybe you should go for maybe more evaluation, more assessment, and maybe you need more medications for this, then you go by the judgment of the person and decide, yeah, I would like to go for better health. Yeah,
Right.
that is one thing you can.
And does anxiety trigger health issues, especially gastric issues like acidity, ulcers, etc.?
Yeah, it can. In mostly in indirect ways, because when a person is feeling very anxious, they can their sleep is affected. So their your biological rhythm is affected to some extent. many people actually start skipping meals because they are feeling anxious, or they have forgotten to take meals, or they are so focused or so engrossed in doing something that they may be skipping meals. So this can lead to heartburn and gastritis. And there are people who tend to worry so much that they can also develop symptoms which are very similar to gastritis, because in if you look at the classical anxiety disorder and the general anxiety disorder, some of the symptoms are this nausea and vomiting, which can happen, and because of that, some people tend to skip meals. So again, this can lead to gastritis. This can lead to more intestinal problems, and people can get constipated because they are not eating well, and this can have again effects on the person's physical well-being. And there are people, and there's the other aspect to it. There are people who can become anxious because of health. Am I going to develop a problem? Am I going to have a problem? Say, for example, we're talking about the COVID-19. Am I going to get COVID-19? Am I going to become sick with the virus? So this can be a health anxiety. So this again does not have to be only gastritis. It can be any form of physical symptoms. We call them somatic symptoms. So it can be body pain. It can be headache. We have heard of tension headaches. People who feel anxious often have headaches, that kind of dull, throbbing ache around the head. And it goes like, they typically describe it as like it's at the back of my head or on the sides, on the temple sides. So this is one common thing which can happen in people who have anxiety. And it also can be related to the lack of sleep or poor sleep. Then there can be body pains, shoulder, neck pains. All these physical symptoms can also occur in a person with anxiety.
Right.
Not necessarily anxiety disorder, even with the anxiety.
Right. Here's somebody who says, being able to stay home has actually helped my anxiety. I feel safer and I'm with my family more, but now I'm worried about returning to office and going out again when things go back to normal because my anxiety may worsen again. How should I prepare for things to suddenly return to normal?
So there was a suggestion I was just reading yesterday. Um, okay, we are talking about going back to normal. We don't know what is normal.
Mm,
Whether the situation we had before this 2020 was normal, or whether the current situation is normal, or what is going to come in the future is going to be normal. So it is, we actually adapt to the situations as they come along. And then that's a human survival. This has been going on for centuries. I think we are not the first ones to do it. We I think maybe in the middle of last century we didn't have I think very rarely we had phones. Then we had cell phones, then we had TV, then we had other things. So we adapted to change. So we will adapt to change. That's just human nature. So talking about this routine, I'm having a routine now. I'm staying at home now. I feel safer. I think all of us feel safe at home. But what has been suggested is that, okay, you're staying at home, you're working from home, doesn't mean that you have to walk around in your home clothes all the time. Maybe what you can do is you can keep to your routine. Like say you start work at 8 a.m. You wake up at your usual time. You take a shower or change and be ready as if you're ready to go to work. And I was reading it. I was feeling it a bit ridiculous because I thought, why would I want to dress up in the morning when I'm at home? But I think it makes sense because you are keeping your routine, keeping your flow as usual. So if your work is from 8 to 5, keep that flow, keep the routine. And if you have to start work, say at 8, 8:30, you have to finish your coffee and sit down to start looking at your emails. You have to start doing work from home. Like say, for example, some of our staff from the hospital are doing that from home. So one of them actually shared with me that she starts doing things the usual way and she stops at the usual time. Say it's 5 o'clock is my knocking off time. I stop at 5 o'clock. I don't prolong my whatever I'm doing beyond that, because again, that after 5 is my family time or whatever time, it's my personal time. So if you're used to going for a walk or your exercise, start doing that. So that doesn't mean that you're staying at home. Doesn't mean that you have to change your routine. Eat your meals on time. Do your exercise on time. If you are used to taking a break during lunchtime, like say 1 to 2 p.m., take your break, go for a walk, listen to music, or maybe look at your WhatsApp messages or your phone or other things, and go back to work at 2. If that is your routine, continue doing the routine. You don't have to break the routine. Yes, of course, you will have a little bit more time maybe with your kids, with your family members. Yeah, spend some time with them. It's okay. Nothing wrong with taking short breaks, maybe more breaks in between. But stick to your routine as much as possible so that it does not look so daunting when you're ready to go back to work. We are hoping that all this will come to a happy ending very soon, and all of us can go back to our usual routine. The routine we were comfortable with, we had built over many years. So
Sure.
I think we are all waiting to go back. So keep the routine now also. Don't have to change it.
Okay. There's a few questions, and I know we are running out of time. Shraddha,
I just
question
have
for you. Yeah, I'll just ask you a question. As a profession in working with students, can we allow them to practice the method that you introduced, that is, the filling the space with circles, as a preventive intervention measures, even if we are not an art therapist?
Yeah, sure. First, I would like to add something what Dr. Nigila said. There is one sentence which we can almost chant daily. There is only one permanent thing in this life is change, nothing else. So we humans are born and brought up in such a way that we can change ourselves to any situation. Okay, so now to your question. Yeah, though we are not an art therapist, or you don't have to be an art therapist to teach this. You can teach your students, your like colleagues, or anyone who get anxious due to small things. You can teach them this type of designs to make them feel calm. So you don't have to be an art therapist. You can use these designs as a preventive measure.
Right. Okay. One question for you, Dr. Nigila. What advice would you give to our elderly population, in particular those who are living alone, do not have next of kin to turn to, and are not IT savvy to use virtual platforms to obtain the support they need?
I think again, we just did a session last week on this, and I think the elderly are a little bit more prone to this problem, I would say, because many of them are isolated, and many of them are not able to meet up with people they used to meet. Like there are family members who would go to meet them, or they would go to meet their family, or they would go to meet their friends. Many of them like the little get-togethers they have with their friends in the void decks or in the elderly care centers, etc. So it is a big change for them. It's not a very welcome change for them. So what I would say is, like, for those who have families, keep in touch with your families. If you don't use social media platforms, it's fine. I think use of phone is good enough. Keep in touch with your family. For the families, I would say keep in touch with your elderly who are living alone, especially. At least one member of the family should be ready to be activated at any time of the day, any time of the night or day. There should be one person who should be ready to be activated. So for those who don't have families, keep in touch with your friends. Again, at least one friend who can respond to you immediately. And if you don't have friends, you don't have family, or you're a person who's known to be independent, who prefers to be independent, keep in touch with the hotlines and all the emergency contacts you can have. Hospital contacts, ambulance contacts, police contacts, all these are easily available, and they're all activated, and they respond to you within minutes. So keep in touch with these people. And many of you may, or at least some of you may be in contact with centers like the family service centers or elderly care centers. Keep in touch with them. There are counselors, and most of the counselors and others are working from home now, and they are available on phone. So you don't have to be tech savvy. You don't have to uh, be aware of how to use your phone or laptop for contacts like this on Zoom or other things. But just be online, be available on your phone. Make sure your phone is always well charged and you are like somewhere near your phone, or your phone is somewhere near you at home. And again for the elderly, I think, like I said, for the other person also, always try to keep a routine for yourself. Wake up on time, or maybe sleep a little later, it's okay, but wake up on time, eat your meals on time, do some small exercises at home. Just walking within the house, or doing some stretches at home is important, because if you don't do that, I think your aches and pains can actually worsen also. So keep to a routine as much as possible, and keep the emergency contacts handy.
Right.
That's it.
So one question on panic attacks. How do you get over panic attacks? The fear of getting that keeps many away from many things. How do you handle it?
Shradha, you want to take that or you want me to answer?
Anyhow, you can answer.
Go ahead, Dr.
Anxiety.
Nigila. Yeah.
Yeah. Okay, panic attacks are a form of anxiety disorder, and they are I would say, more debilitating in a way because they happen very suddenly, very acutely, and there can be triggers. Sometimes there is no trigger, and they come. It's an attack. So it is like an anxiety attack which comes, and the person feels very, very uncomfortable. There can be this very intense palpitations, the heart beating fast. You are not able to breathe well. You feel as if you're suffocating. You're going to feel dizzy and faint. Some people say that I feel like as if I'm going to die. And it lasts and it feels so real, so uncomfortable that the person is really suffering. So these can happen to any person, especially those who have had this experience. They can tell you how much it affects the person. So what you can do is, again, you need a proper assessment. You need a proper form of help. There are many people who don't like to take medications on long term. Yes, we respect that. But short term uses medications, when you anticipate this is coming, because most often, more than 95% of people, when they know that they're going to have a panic attack, if they have something like a premonition, they have something like some aura that this is going to happen. So when they know that this is going to cause their panic, or when they are in a situation where a panic can happen, like say for example people who are afraid of closed areas, who are claustrophobic, they know that they're going to go into a small room where maybe there may be a lot of people. So what they can do is they can do the anticipation. They have the anticipatory anxiety, so they can take short-term medications for that period of time. Just a small dose of medication before going into that area, like before taking flights or going into the lift. So this can be done, and you can learn relaxation techniques. You can learn the breathing exercises, and this can be practiced before you go into that environment where you it can be provoking your anxiety or your panic, and also during the phase when you are in that situation, in that environment. And this will bring down your anxiety. It may not completely prevent the panic coming, but at least the intensity of the attack won't be so bad. So you can actually manage it pretty well, and you can come out and you can go about your daily activities. Just to remember that a panic attack happens, it seems like a really long time when it happens, but actually if you look at it, it's only a few minutes. And after that, you may feel drained, you may feel tired. But if you are able to get some rest for, like, say, 5 minutes, take a small drink, maybe a cool drink or something, you should be start feeling better by then. So
There are
relaxation techniques will really help.
There are two types of therapies. I will like to add something along with medication. There are two types of therapies which are very effective. This one is exposure therapy and one is systematic desensitization, where Dr. Nigila, as she mentioned, that where we teach exposure therapy is one type of therapy where we expose to that particular object or that particular incidents due to which a client gets panic attack. So it affects like its act other way. And systematic desensitization is like a process through which we relax ourselves. It is a relaxation technique where we try to focus on our breathing, focus on that body part which we feel anxious or which we feel lot of pain, and we try to relax that. And this will also help in panic attack, not immediately, but yeah, surely it helps along with medication.
Okay. Thank you, Shraddha. I think there's a couple of questions. One is, how likely is a person who's highly anxious that they'll want to end their life? Is anxiety related to suicidal episodes?
Yeah, I'll take this question. Yeah,
Mm.
there have been instances where people are extremely anxious, have taken their life, but it is not a very common association. But again, there can be several other reasons for a person to take their life. So when a person feels very helpless, So the underlying problem in suicide is feeling helpless. So that is when suicide can happen. Since that is not the focus of discussion today, I can say that anxiety, yes, when it is extreme, when it is very severe, we have had people who have lost their lives.
Okay. All right. Can prolonged working on a computer cause insomnia?
Yes. Yeah. So I think if you have been focusing too much, you've been straining your eyes, and you've been sort of neglecting your other needs, your bodily needs. This can actually make you feel exhausted, and this can affect your sleep to some extent. I think so.
Mm.
Even
Um,
smartphone can lead to insomnia.
Eye strain is not good for your sleep also,
Watching
because when you sleep,
smartphone before going
yeah,
to sleep.
yeah,
Can
similarly,
lead to insomnia.
yes.
yeah,
That's why I said
the
switch the
blue
phone off,
screen.
switch all
Yeah,
gadgets off as much as possible. Yes. Yeah.
correct. One other question about going back. There will be several persons who will be anxious about returning to their day-to-day jobs after 2 months circuit breaker. They'll also be worried about a potential second wave of COVID-19 infection. What advice do you have for these persons?
Yeah, one thing I have to say that we still have a lot of questions about this virus. This virus is, I think, one thing that has been baffling people. Like the most advanced technology, most of the experts in the world are still working on it. So we do not know whether there will be a second wave. So let us assume that there is going to be a second wave, or there's going to be like a possibility of a second wave. What we should be doing is like continue to practice what we have been practicing now. I think it is important we maintain all those social distancing practices, the safe distancing. Even when the government order came that there will be some relaxation which will be coming. Yesterday I was listening to Mr. Lawrence Wong saying that yeah, we are going to relax, but doesn't mean that we are just dropping everything. We still
Correct.
be cautious. We still have to practice what we have been practicing. So the safe distancing, social distancing is important. Still keep that. Doesn't mean that you have to run away from people, but maintain distance. That is important. Maintain the higher hand hygiene. Wash your hands. I think it's general practice. All of us have been taught from young. Wash your hands before you eat, after you eat. Wash your hands when you go to toilet. Wash your hands when you have come back from outside. Continue to practice all this. I think it is important. And if you have young children at home, or you have elderly at home, make sure you go home. You don't go touch anything. Just go straight. Wash your hands. If you can, take a shower right away, and then change from your work clothes or outside clothes and change into fresh new clothes, and do whatever you do. So I think that is important. I think these are very basic, but if you continue to practice that, then our chances of getting the infection will be much less.
Right. Um, I think one quick question, and I'll ask you, Shradha, one more question before I think we should try and wind up. My jaw feels tight and sore. Is this a symptom of anxiety too? Dr. Nigila.
It can be a symptom of anxiety, but unless we have examined you, unless we have got the background of what is happening in you, we won't be able to tell for sure. It depends on under what circumstances your jaw starts stiffening and feeling tight. So this
Yeah.
needs to be properly examined. Yeah.
I mean, I know people who have clenching of teeth and stuff like that. I think then they do have tightness, but I think, as you said, you need
Mm.
to
Yeah.
examine.
Yeah.
Okay. Shraddha, one question, how is art therapy different from journaling or meditation?
Yeah, I was really eagerly waiting for this question because Dr. Nigila was telling like how we are going to adjust with the change situation after COVID-19. Many people are getting anxious that how are we going to adjust with our after COVID-19 situation. So one thing I would like to add here that you can maintain journal even today, like even from today itself, you can make a diary or make a journal where you are noting, like you note down each and everything you do during the day. Like what are you doing? Getting up at 8 o'clock, having breakfast, then having like online work, and getting lunch and all those. If you are trying to note down each and everything and keep a journal for your regular routine. Also, you have to note down what was your routine during your office days. Say, for example, like today, I got up at 8 o'clock. I took my breakfast at 8:30 and I left for my job at 9 o'clock. This was my regular routine. And today my regular routine is at 9 o'clock, I am on my laptop for my online work. So you will have handy what is the difference between today's situation and what is going to be different from like in coming time, like, okay. So maintaining journal will surely help you. Now, how it is different from art therapy or meditation? So what I can say, when we maintain journal, we just write down, we just note it down. We can like combine art therapy and journal together, where we can imagine, we can draw, or we can do some creative things in our journal along with writing down or along with making notes. So it can be combined together. It is not a different thing, but it surely can be combined together. A book, a simple book like this, where on one page we can draw and one page we can write. So this will be also very handy, and see to it that this is handy. It's not that you have to search. See to it that you place this journal somewhere where you can easily go and take it. Now, your second question, how is art therapy different from meditation, or what is difference between art therapy and meditation? As per my experience, I feel art therapy is first step towards meditation. Meditation, what does meditation does? Meditation does, like, it calms our mind. But for meditation, we have to sit at one place and we have to focus. Now, art therapy will help us to focus on our body parts, on our breathing. So it is like a first step towards meditation. It will help you to meditate very easily if you start with art therapy. So this is how, it's not different, but it surely helps.
Right. And you said when you were doing the initial example that within 1 to 2 weeks you should start seeing a difference, right? Okay.
Even say, for example, like for 5 minutes continuously you're doing this design, 5 minutes continuously on 5 lines. When you start from here and when you end here, you will see difference in your breathing and even in your hand movements.
Right.
So that difference also will lead to meditation.
Right.
Because it will calm your mind.
Right. Thanks. There was a question on, I think, depression, but I think we are run out of time. I would suggest that you look at the webinar from, end of March. We had a whole discussion on depression. So if you want to know, whether you have depression or not, then just check that webinar out, but talk to a specialist as well. I think there's a question which says, can anxiety give you fear?
Yes. Anxiety is known to cause fear, or fear can actually present as anxiety. So it is actually, again, a human response to a difficult situation. So when there is fear, there can be anxiety. Or when there is anxiety, there can be fear. So there can be this fear of whether I'm going to get an infection, whether I'm going to fall sick. So that can be a symptom or a feature of anxiety. Yes.
Right. Thanks.
It is.
And what if a senior wants to go out for a short while each week and doesn't want anyone to accompany them?
I think we can't completely stop them from going out, but what is generally understood is that this infection can affect the elderly more than the others, because because of one thing is because of the age, and because of
low immunity system.
Possibly they're having underlying medical condition. So what I would say is, if they really want to go for a walk, or if they want to like take a walk around, again, remember the social distancing, wear a mask, maybe a proper convenient as well as very safe mask. Surgical mask should be safe, and go down. They maintain distance, they go somewhere close to home, maybe not very far. I mean, some people are used to walking in the gardens and parks, so don't go so far. Walk near home. I think it's going to be allowed from next week onwards. So you can actually walk near your blocks, go around maybe 1 or 2 rounds, and maintain social distance. And definitely, when you come back home, wash your hands, wash your feet, and change clothes if possible. Once in a week, I think that should be possible to do. If they are able to, for the mobile ones, for those who are independent, I think that should be okay.
Yeah, and I think one thing that we do notice and we've seen also is, since unlike doctors who are used to wearing masks, most of us are not used to, so we keep touching our masks. That's something that we need to avoid as well. So that's, that's something that we need to really watch out for, because when you touch a mask, all the germs are actually on the mask, and you're, then touching it,
Yeah.
and then you'll touch your face in different parts. So that's something just to be really careful about. I think,
Carry small bottle
And
of
also,
sanitizer.
sorry?
just one more thing to add: when you're getting into lifts and when you're getting into lifts in the elevators, what you can do is try not to hold the railings. If you really have to hold something, even if you don't like, maybe use a walking stick or something. And if you have to touch the railings or the sides of the lift, definitely go home and wash your hands. I think that is very important.
Correct,
Or
A
you
correct.
little
can
bit of
carry a small
extra
bottle,
caution is better. Yeah,
small bottle of sanitizer.
Right,
yeah,
right.
that'll
Yeah. Okay, so I think we
be good.
will wind up. Yeah, we will plan a next webinar and get back on what it is. If you have suggestions on topics or what you want to hear about, please write into Club2Care or Patients Engage. And let me quickly, I think we have a couple of slides on resources, so let me just share that. So I think most of you may already know, but here are some resources for the COVID situation. There's a national care hotline number. There's a Singapore Silver Line for seniors. There's another one for seniors called SAGE. Plus you have the IMH helpline, the Samaritans of Singapore, and the Agency for Integrated Care. We also have Club2Care, which is offering free counseling in English, Tamil, Hindi, and a few other Indian languages. They can be contacted between 10 a.m. to 6 p.m. on Monday, Wednesday, Friday, Saturday. For now, definitely all through May. And yeah, and I think, as we've said, you can reach out to Patients Engage, you can reach out to Club2Care. We are, also on Patients Engage, you'll find that we've put up resources on our YouTube page on the various webinars, sleep hygiene, and things like that, as well as on our website. We'd also like to thank SINDA for supporting the Club2Care outreach program, including this webinar. And I know there'll be a lot more questions, but I think we've run past the time. So I'd like to thank Dr. Nigila and Shradha Mestri for taking their time today on a Saturday afternoon and talking us through this. And yes, and just stay strong, stay safe, stay calm, and we will all get through this soon. So